Hi everyone, it's Michelle Baltazar here from the Australian Filipina, and this is part 2 of my interview with Dr. Angelica Logarta-Scott and Jess Helaratne from New South Wales Health. Thank you so much for joining part 2.
Hello!
Hello,
Hi!
kamusta ulit?
Hi, everyone!
Hello,
Hello.
everyone. Thank you for having us again.
Well, this is Australian Filipino magazine just wants to give our readers more information and education about COVID-19 and staying safe and preventing the spread of infection. So thank you so much for your time to provide us with that. So I think the two topics we want to cover today is social distancing. What does that really mean? And secondly, what does self-isolation for 14 days mean? So we'll kick off with social distancing. Dr. Angelica, what is social distancing?
So, basically, yung social distancing talaga para sa ating mga Pilipino at para sa lahat is really making sure na you are, hindi kayo magkakalapit, okay? At least 1.5 meters away. At kung pwede, more than that, if kaya natin. Kasi nga alam natin na yung mga hininga natin, yung mga droplets dyan, can sometimes go a bit more than that. So yung ating mga, make sure na palayo-layo talaga tayo. At least 1.5, but if you can do more than that, that would be great.
Mm-hmm.
Yeah. Tapos kung nasa Caron, sorry.
Yes, go ahead.
Kung nasa loob kayo ng bahay, kasi alam niyo na yan siya yung enclosed space. Again, hindi tayo nasa loob ako ng bahay, baka pwedeng yung kaibigan ko naman to, kapamilya ko to, kapatid, in-law, okay lang tong ganito, 1 meter. Hindi pa rin. Kahit na nasa loob ng bahay, 1.5 or more pa din.
Mm-hmm.
Ganon.
All right. So, okay, klaro ha, dalawang dipa.
Now,
you've got to do two arms length
or more.
Yes, yes. So, let's talk about, hindi to sa mga pasaway na Pilipino ha. They're doing the right thing and they're just going to the groceries to do their shopping. So, how do you prevent catching COVID-19 from going to Woolworths or Coles or Aldi?
Well, I think the best way to do it is just to keep that distance. The best way is maybe 1 trolley or 2 trolleys away, just so that you can visualize it. Make sure that pag nandiyan ka sa grocery, make sure that there's 1 trolley apart or even 2. So there's that distance. Kasi I think hindi tayo sanay, we're all if you're going to the shops now, I get really worried because people are just complacent again.
Yes.
People are just going shopping, and you yourself have to go, wait, I have to take the distance. I have to make sure that I'm this far apart, or there's a trolley, or for people or for mothers with a stroller, make sure that there's that's your distance. You have to find a way that will help you visualize the distance, because 1.5, as I said earlier in our discussion in our first part of our conversation before, is sometimes we don't know what this is. And when we're with relatives and we're talking to people and we know our friends, we kind of, it's just our Filipino way of kind of moving towards, we're social butterflies. Where we like to talk to each other and we like to be engaged. But during this time, showing your care and love is by staying apart, and that's 1.5 to 2 meters.
Wow.
And so when you're going to the shops, make sure you wash your hands. They provide that. If you don't have it, then you just wash your hands, wipe off the trolley, and when you go home and you go into the car, wash your hands again. I think that's the best way. Anything, and also when you're getting your groceries, when you're getting your apples or getting your bananas, you're touching the hands. Get a plastic bag, use your plastic bag and put it, and just take and choose your fruits. I think that's the best way to think about it. Get the plastic and use the plastic to pick up what I need to pick up.
Para namang overkill, but do you recommend masks and disposable gloves?
for me, ganito, yung disposable gloves, I think hindi ko recommended yon. Kasi ang nangyayari kasi nagiging complacent tayo sa kung may gloves tayong suot. Kala natin protected tayo. And what happened is we touch one thing and then we touch the face and we touch our phone. So mas at risk na tuloy. Better yet, walang gloves, but may dala-dala kang hand sanitizer all the time. Or kung maka-wash your hands, that would be lovely. Yung mask, ngayon sa New South Wales talaga is highly recommended, you know? Na if you're going out to groceries or yung mga businesses and shops and other areas, this morning at sa news narinig ko, highly recommended nila kasi nga with the rising cases that we have. But you wear it properly, hand sanitize your hand before using it. And this is one thing that I always tell my patients as well. Like afterwards, nag-grocery na kayo, nasa car na kayo, minsan dinalagay nyo tapos pinasok sa bag. So you have to know how to dispose it properly. So I always tell them, magdala ng maliit na supot, okay? And then put your disposable mask doon sa supot. Then obviously when you get home, you can dispose it to the bin. Kung kung yung washable ang inyong mask, kung uncomfortable na to drive home na naka-mask pa, take it off, put it again in a little supot container or a little plastic bag or something like that. Now you can put it on freezer bag, yung maliit na freezer bag, put it on, and then have the hand sanitizer and drive home. And also when you get home, this is again over the top na siguro, pero making sure din yung mga grocery shops nyo is material wipes. I think that's over the top, pero we know that COVID-19, they stay on surfaces for days. So it's important to do that as well. Okay?
Doctor,
can you just repeat that because the Wi-Fi connection was weak? So what do you do with the groceries?
So for example, you got in at home yung groceries nyo. Always remember then na COVID-19, yung mga viruses, they stay on the surfaces for days, you know? So we don't know kung when you shop, malinis naman siguro, but when you get on at home, make sure meron kayong yung mga antibacterial wipes and you wipe them before you put them away sa inyong pantry or in the fridge, just to be on the safe side. I know this is a bit over the top, pero where if there are more cases na there will be more cases, then we have to be more vigilant. Okay? I hope that's clear to everyone.
I think also one of the things we have to remember, we like to also visit. We go shopping, that's an essential, but also visiting restaurants and going out and having coffee with friends or with family. I think those are the things that we have to remember, that we also forget about social distancing when we're sitting down and we're having a conversation. 1.5 is still the way to go. And make sure that there's a distance when you're sitting down. I know when you're with family, doctor, di ba sinasabi, if you're living together, that's okay. But I think ang advice is always still make that decision, because it's just important that you keep that distance and practice as much as possible, because this is the new normal at this point in time. As Dr. Logarta said in a previous discussion, it's not going to go away for now. This is going to be here for a while. The Multicultural Health Communication Services, we usually host Multicultural Health Week, as you know, Michelle, every September. And we thought we can have the launch that we were going to have all the time at the Parliament House, where we can have media and all the guests to come. Usually 200 people attend. But we can't do that now. The way to do it is to do a digital launch and to launch things. It's just so different. it's just the way it is. It is different. And we have parties for 50 people where 30 people come to the house, or we go out where all of us friends and ladies, we go and have champagne or whatever and have fun and go to the movies. It's just not happening right now. That's not being careful, and that's not being responsible for your family and for yourself.
Yes, true.
Mhm. So I'll just ask you again, Dr. Lagarta. A lot of people will say, is this real? Like, I need to pause and think 1.5 is quite a long distance if you think about it. It loses the intimacy of talking to people. Parang, tapos antibacterial wipes, lalo na sa mga tamad. You know, you're expecting me to wipe all my groceries, ganon. Personally, we're doing our shopping once a month na lang. There's a lot of bulk shopping to avoid going to the groceries. Pero ganito ba talaga kagrabe? Like, just being careful. I mean, that just seems unreal, to be honest.
Totoo. It seems to be parang ano ba, we're living in a
Twilight Zone or
different
something.
different world, you know. This is something that we haven't visualized. Now will be, you know, doing like this all the time, you know, not going to work. What I mean is doing work from home, and also yung 1.5 meters malayo kayong mag-usap na yung mga friends. But we have to think this is really real. You know, this is really now a new normal. Yeah. And we have to, the sooner that we can, you know, we can adapt to that, the sooner that we can really realize na totoo ito, the better. Kasi nga, para naman maiwasan natin ang COVID, hindi lang sa ating sarili, you know? Maiwasan natin ang pagpasa nito sa mahal natin sa buhay, you know? We have to think not just about ourselves, but about the people around us. You know, this prevention of this or fight for COVID, we have to remember this is a collective community effort. You know, it's a partnership between the government. Ang gobyerno natin, they're doing their very best. They're very good. You know, ginagawa nila lahat. So it's a partnership between them, the government, and the community, you know, and then working together, doing your part, doing your role. You actually have the community, the people all actually have the biggest role here to keep that commitment, to keep that discipline, and to keep that, to accept na ganito na talaga ang new normal. And then together, if we work this together, then obviously we can control the emergence of the cases, and we can control this COVID, and hopefully mawala. Yeah.
Until we get the vaccine. So Jess, now we move on to what does the 14-day isolation mean? And we really need to break this down, ha? I will be asking stupid questions like, is it separate plato and cuchara tinidor? Do you have to sleep in a separate bed? Do you have to use a different bathroom? So I'll give this to you first, Dr. Logarta. What does 14-day self-isolation mean? And what are the misconceptions, Jess?
How long do you need to be in home isolation? So I guess the most important thing is 14 days, and that's in close contact or casual contact. Getting to your home, if you're a close contact, people identified as close contacts should travel directly to the place where they will undertake their self-isolation. So and explain that in ni Dr. Lagarta, yung close contact is if you've been with someone more than 15 minutes, or if you've had close contact of someone with COVID-19, and also if you've had casual contact, and she can explain that later. But I think the misconceptions of what people have when they say home isolation, I'll just stay at home, that's it. I can just stay home, hang out with the family. When they say home isolation, you have to separate yourself from the other people in your home. You have to remain separated from others. You have to wear a surgical mask when you're in the same room as another person. You have to use, if possible, a separate bathroom. And I guess that's when cleanliness and sanitation applies as well. Avoid shared or communal areas and wear a surgical mask when moving. not to share plates, not to share cutlery, not to share glasses, and also possibly have your own plate and glasses for the meantime. And under no circumstances should you be in contact, or at least in close contact with with the people you're living with. And they say do not go out at all.
What about your
That's the most.
garden? Can you go to your garden? Can you go for a walk around the neighborhood, or go
Yes,
go to the fish and
well,
chip shop? What's
Yeah.
no, well,
So,
actually, they
yeah.
say that you can't, if you can't go to the school, your home isolation means you stay at home and you restrict from your normal activities. Don't go to work, don't go to school, don't go to childcare, university, recreation, groceries even. And you should not allow people to come and visit you when you're in isolation. You can leave your home only when you seek for medical assistance. If you forgot, have to go to doctor like Dr. Lagarta for medical
But call
advice,
first.
but you have to call
Call
first.
first.
And there is a
Or
telehealth
not,
if
don't
there's a,
go, just call.
just call. And they're saying if you ask the question, can I go into the garden, if you are completely well and do not have symptoms, you can go into your private garden or courtyard, or to your private balcony if you have one. You just need to separate yourself until you know that you are safe and safe enough to be with others.
Yes. I
Dr.
think,
Lagarta, anything else there?
yeah, you mentioned most of them, all of them, that's all correct. Also, remember, discipline and complete the 14 days. News, yung mga positive cases doon sa Victoria. I think 1 in 4 when the government wala sa mga bahay. So again, discipline talaga. 14 days, that's not long. I know for some people it's very long, but try to do other things. Marami naman other things you can do. Really occupy yourself, to complete that 14 days.
Yes, you can take up knitting if you want, build
Yes, new hobbies, new
new
hobbies.
Painting.
write a
Yeah,
novel,
now we
karaoke.
suggest, now when you do karaoke, do it by yourself, not with people around you. Remember that, because when you're singing, that's when things. So I think those are the things that we have to remember. That's why they're saying do not sing with a choir at this time. Do not sing. So if you do sing, make sure that you're within a specific area in your room. Sing, sing, sing. That's fine. But with others,
That's correct.
What's your responsibility in terms of telling people that you are COVID-19 positive? Of course, you have to inform, say for example, I'm working in the office and then I find out I'm COVID-19 positive. What are the first steps? What do I do?
So, firstly talaga, that is your civic and public duty talaga to inform people or workplace or anyone that you've been na you're positive. So firstly, if at work, obviously you have to inform your line manager. But also, if you are, hindi naman ikaw ang tatawag-tawag sa lahat ng mga taong nakasalamuha mo. Obviously, yung very close friend mo talaga nakasama mo kahapon, the next day, or kasama mo sa work, you tell them, oh, I turned positive. Or maybe your manager naman will help. Pero this is the thing what's happening with our government, which is very good. We have a very good contact tracing, okay, of cases. So once it turns out positive, the contact tracing people, yung tatawagan naman nila lahat, they will go through your history kung saan ka galing from that day at saan ka nagpunta. So they will trace those areas, those places that you've been, and they will notify them and they will let them know. So hindi mo na kailangang isa-isahin pa yon. Pero obviously, kahit na hindi ka nag-turn out positive, but kahit nagpa-test ka lang, you just have to let your work know so that they are aware na if they develop symptoms, kasi nga obviously 2 to 3 days pa yung result, they will watch out for their symptoms. Para aware din sila.
Mm-hmm.
Yes.
And finally, how contagious is COVID-19? Sa isang ubo lang ba, or someone touches you? What is it? Is it, if you keep it under 15 minutes, okay lang? Can you shed light on that?
Yeah, so it is very contagious. Okay, so merong it's a very technical yung tinatawag nating viral. It depends on the viral load. It's very technical scientific term na yung bang ano ang infectivity rate ng COVID-19. So I think yung mga when we have when it started yung mga ang sabi is 3.5 ang infectivity rate nito. So it's quite high. So it can infect kahit na yung nag-sneeze ka or nahawakan mo yon. But again, depende pa rin yan sa viral load na nakuha yung tao. Okay? So mostly yung mga severe cases that are in the hospital, yun yung nagsished more ng maraming viral load. Yeah? So that's why important yun sa mga healthcare workers natin doon na nag-work sa hospital na well-protected sila. Pero it doesn't mean na sa community hindi mag-spread. Kasi meron ting mga tinatawag nating asymptomatic spreaders. Nag-spread na kahit na wala silang symptoms. Which, yun ang mas nakakatakot kasi hindi natin alam. Kaya, ang advice nga nila, sabi nila, if you're going out or you're seeing people, just think na baka may COVID to siya. It sounds very, yung parang, naman, hindi naman tayo makakaano na nito kasi everyone, you will think na may COVID. Pero I think that's the safest way to think, na baka may COVID to siya. May COVID to siya. And not to be complacent. No, na ay, wala siyang sipon. Ay, it's okay. So, just, think na everyone could have it, na walang symptoms.
Mm-hmm. All right.
And I think we have to remember as well that it doesn't choose anyone. There's no one, even the highest officials in a country gets COVID, and even someone who you wouldn't have thought would have COVID could contract it. It also is important that we, as Dr. Logarta says, that there are tips and safety tips that we have to follow. They're not there just to share, hey, keep physical distance. That's what you do. I'm not just saying that because it's nice to say. It's about safety. It's about making sure that you're safe so that your children will be safe, or your parents will be safe, or your cousins and friends are safe. If you're being careful for yourself, then you're being careful for the community. And look at what's happened across the world and what's happened we are very, very lucky at this point. But if some people just get complacent and they don't wash their hands just for today, then that could mean a big circumstances for the community, and that's not something we want to see. It's showing our care and love, and that could be the greatest love of all, by just following the safety rules.
Excellent, thank you. So Jess, can you tell us again your role at New South Wales Health? And I know that you're part of the Multicultural Health unit, and also what educational information do you have about COVID-19 available, and tell us the website.
Yes, okay. Basically, I work with the New South Wales Multicultural Health Communication Service, part of Health. I'm a deputy director of our Multicultural Health Communication Service. I also work and embedded in the New South Wales Health as part of the communications team. That's the State Health Emergency Team, the SHIOC, where all the communications on COVID-19 comes from, and then we share out, we develop resources in languages. So you've seen that, Michelle, that we have social tiles in Filipino. We've also got a social media tile of Dr. Angelica Logarta-Scott in Filipino and in English, making sure that people get tested. So we're doing that across the board because we know that as a community, we want to see people from our community sharing these messages. So, and that's across all communities and across all cultures and diversity. So there is a website, the Multicultural Health Communication Service website, which you can get the resources in languages on health, but as well as in the COVID. But go into the New South Wales Health website, and you can click on that link, and it's got all the translated resources. We have some in English and also in Filipino as well.
Fantastic.
And what's important is that we all get stressed. We all get this is not the normal thing, you know. Everywhere you turn, everyone's talking about COVID, and you have to take care of your mental health. I think that's so important. Connect with someone, talk to the family, and know that we're all in this together. As they say, as they quote, we're all in this together. There's no one else who can help us but ourselves and our families. Keeping yourself and your loved ones safe is the most important thing.
Excellent. Thank you. Thank you once again. Thank you for your time, Jess, and thank you for your time, Dr. Angelica.